asking me to do it more in SET. So, guys, you might see something on your screen now just saying that you're live. Don't worry about this. It'll just be 10, 15 minutes. We're going to start the class now. So, could I start by asking for Murad? Would you mind putting your microphone on,
Yeah.
Murad? Just say hello.
Hi. Hello.
What is information gathering, Murad? You know,
It's asking questions.
asking questions. Tell me more. Tell me more about that.
It's two type of questions, open and closed question.
Okay, so guys, he's saying information gathering, can't type today, Murad, is equals asking questions. Theodora, do you agree with that? Is he
Yes,
right?
yes, of course. Yeah.
He's sort of right, is he? Well, can we go a bit deeper?
Yeah, it's
I think this is the
open
main idea, right? This is definitely the main idea. But why do we study it?
because it's part of the criteria what they are
Uh,
asking from us.
so this is the name of one of the criteria as well, guys. If anyone is new to OET, we study what OET, how OET grade you. This is an exam class, right? So Murad's right. Today we're talking about asking questions. That is the most important thing. But we're studying this because OET are grading you. Does anyone know the scores you can get? Mubin, do you know what the scores you can get for information gathering is?
I
It's
think
0 to 3, maybe.
Just Mubin, please. That was just a question for Mubin. Mubin, are you there, sir?
you
No?
can't speak.
Can't speak. Okay. Nilafar, can you say hello?
Hello,
Auslan.
sir. Hello,
Hello,
sorry.
Nilafar. So is it 0 to 3? Are they right?
Yes, sir.
Scoring?
Yes.
So I've lost this here. Sorry, guys. 1 second. So the scoring is 0 to 3. And what does criteria mean, Nilofar?
The design.
The design? Can anyone help
No,
with
sorry.
criteria? Anyone here? What is criteria?
Scoring.
Sure.
Scoring.
It is
Yes,
scoring,
scoring
scoring
system. Yeah.
system. Okay. So we're studying, basically, this week we're studying asking questions to patients. But it's also something that you get a score from 0 to 3. Everyone here, everyone in this class, you can all score 3 if you just know if you know what OET want. Okay, guys? So let's think about what OET say. What do OET say about asking questions? Maybe Suleiman, do you know how many points they make? How many points? Maybe Nwimba, do you know how many different things OET are looking at?
Okay, with the information gathering, 5 points.
5. So 1, 2, 3, 4, 5. Is that right, guys? Is she right there?
Yes.
She is. Okay. So we always start with this idea of what do OET say? I always like to just give you the main idea and then start with what they say. So this is what OET say. Murad, I really like this answer. It's asking questions. Okay. But OET say there's 5 things. So here they are. I'm going to give everyone 1 minute to read this. Just read and think. Okay. This is what OET say. This is the criteria from OET. I'm going to time you all. Sorry. I'll just give you all a bit of time to read. Just think about, what does this really mean? It's a lot of things as well. 5 things. Okay, that's approximately 1 minute. Yerim, can you say hello, Yerim? If you're available to speak, Yerim. Maybe not. So no Mubin, no Albina, no Shrad, no Eljana. Eljana, did you just join us today? Okay, so Yerim, last chance, Yerim. You didn't tell me you weren't speaking at the start, and now you're not speaking. No? Okay, guys, you got to tell me. I just put him outside, or her. This is an exam class, and I really, really think we need to take this seriously. So if you're not going to speak, tell me in the chat, or you're going to answer some questions. There's no middle ground. Julia, could you help us with this? If you could put your microphone on, Julia.
Yeah.
So, Julia.
Yeah. Can you hear me? Yeah.
Yeah. Do
So
I have to do, what's a question? Do I have to do all of these things all of the time?
No, because it depends on the answers of the patient. So
Exactly.
not all the time. It depends on the situation.
Exactly. Exactly. Which one, Murad said asking questions, when he said that. Which
Yes.
one is that? D1, D2, D3? Which one is that?
D2, I would say.
Is she right, guys? Is D2 the same as Murad's asking questions?
Yes.
Yes, okay. And Murad said that because, well, he's been in classes with me before. This is the key, the most important thing. D2. Sorry, not D1, D2. Asking open and closed questions. Now, Camila, what is an open question? What is a closed question? Could you help us with that?
Yes, an open question is when the patient can talk many things, whereas if I ask a closed question, he can only answer yes or no.
Ah, okay. Now I used to say that, Camilla, right? So she's saying that a closed question, guys, is only yes or no. But
Or
can it be something else as well, guys?
yeah, but it's like I'm giving options to answer.
Options, exactly. So I could say, Camilla, do you want to eat pizza or pasta? That's a closed question, right? She's got 2 options. So guys, D2 here, I'm going to make this really simple for you. All right, D2 is asking questions, as Murad said, and it's the most important one. We're going to spend a lot of time practicing the questioning this week. So Tuesday, Wednesday, Thursday, Friday, asking open questions and asking closed questions. What's an open question? Anissa, Albina, what's an open question?
Yeah, so I believe that an open question in when we want to gather as many information as possible from the patient.
Well, sort of. Could you give me an example?
General question? Can we say the
A general.
question?
So if I say, is this an open question? Anissa, so do you generally feel bad? Is that open?
I think no, because you're gonna say yes or no.
It's a yes, no, isn't it?
Yeah.
So, Teodora, what's the classic open question in an OET that we always...
Yeah, we can say, could you please tell me more about that? Because we can encourage the patient to speak more about his problems.
This is the classic one, guys, that I'm going to mention to start off with. But there's many more. Could you tell me more about that? About your symptoms is one. You can also say, why?
How are you feeling today?
You could say, how are you feeling today? Or you could just say, why do you blah, 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 blah. That's open. Okay. But the point is, guys, the patient is not going to give a yes or no answer and is not going to choose between options. tell me more about is not giving options. You can say anything you want. Okay. We're going to come back to this later. But closed questions, guys, if you want to know, you're going to be saying, do you, have you, can you, like that, or are you? What about, though, let's go back to these criteria. I want to make a very simple diagram for you all this week, okay? Because speaking, you need to keep things simple with what you're trying to do, because you don't really have any time to think about it. So we're going to make this as simple and as clear as possible. D2, asking questions. What is D4? Anna, could you read D4? What does that say?
Clarifying statements which are vague or need amplification.
So it's, how do we pronounce this word, guys? V-A-G-E, does anyone know? Say?
Vague.
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 Okay. Now, what does that really mean? Nwimba, could you say hello?
Hello. What I think is when the patient tells you something, but you're not sure. Maybe they've mentioned a lot of things, and you didn't capture well. So you ask maybe like, just if I understood you clearly, you told me you have headache, vomiting, maybe, and stomach pain. Is that right? Just to confirm from the patient. I'm not
Yeah.
sure. I think.
Okay, so we'll give an example in a second, because your example, I'm not sure, your example is more like D5, summarizing. Okay. But D4, could you make this more simple? What does that mean? What's the main idea of all of that complicated sentence? Can you make it really simple for us? What does it mean? Just her, guys. Nwimba, what does it mean? What's the most important word in that sentence? What's the most important word? She's saying clarifying. Guys, is that right, everyone? Clarify?
Yes.
Yes. Okay. Clarify. I mean, do we need anything more? Clarify. Of course, statements. Of course, statements. So, guys, clarify anything unclear, maybe? Anything unclear, we could say. How do we do this? I want to ask someone, how do I clarify something that's not clear that a patient maybe said to me? Mamata, if a patient says, Julia, you don't really understand it, what can we say?
We ask again. We do a closed question for that thing that we are not sure if the patient understood, or for something that patient said and we might misunderstand.
I think it's not necessarily a closed question, definitely a question. What do we say if I say to you, Julia, well, I have to go to the greenhouse because I don't have any more shoes. What are you going to say to me?
But sorry, what is a greenhouse?
Yeah, what is or what do you mean by, right? What do you mean by greenhouse or something like this? Or guys, when you said blank, what do you mean? What do you mean by that? Or can you no, just what do you mean is fine. What do you mean by that? Okay. So guys, your scoring in OET are going to reward you. It's a good thing if a patient says something and you clarify it by asking them, when you said pain, what did you mean exactly? Okay. So here's two simple phrases. You could say more. It's not just one thing. There's many different ways to do this, but here's two simple examples. Okay. What about D1 now? Theodora, could you read D1? What does it say?
Yes, facilitating the patient's narrative with active listening techniques, minimizing interruption.
Okay, so that is so long. Fatima, Fayaz, what does that mean really? Facilitating the patient's and blah, blah, blah. What does it mean really?
Active
It
listening.
means
Fatima or Fayaz? Active listening.
and directing the patient with how can I say right information.
Well, it doesn't say directing here, does it? Does it say directing the patient with... It doesn't say
No, it's
anything
like
about
a
that.
narrative.
It says active listening. Is there another really important word here, guys? Not
Using listening technique.
Not interrupting.
interrupting, maybe we can say. Someone said listening techniques. Who said that? I like that. Listening techniques.
Nilofar.
More general, okay?
Yes.
So listening techniques and not interrupting. So what is a listening technique? There's 3 listening techniques, guys. Main ones. Think about this. Well, one second. Think about this. How do you show OET, the exam, that you're listening? Well, they cannot see inside your mind. They can't see inside here. So you have to do something. The first thing is really easy. I'll just tell you. It's called filler sounds, right? And you're going to say, uh-huh, mm-hmm, like that. So really, really easy. I don't think I need to teach this to anyone here. Just making those normal sounds, uh-huh, mm-hmm, you're going to score because you're showing the patient that you're listening to them. Now, Yerim, are you going to speak this time, Yerim?
Yeah, by echoing what the patient said.
Echoing, thank you, echoing. So if I say to you, Yerim, I have a really bad headache, you say,
Oh, bad headache.
yeah, guys, you can repeat back bad headache, what they said. This is listening techniques. Okay, listening techniques. Number 3, Dina, do you have any idea of another thing I can do? I can use filler sounds. I can echo. How do I show that I'm listening?
I don't remember, sorry.
Dina, I'll give you an example. Listen to this. Mm-hmm, mm-hmm. Bad headache. Mm-hmm, mm-hmm. I see. Mm-hmm, mm-hmm.
Some phrases. I
Just
see,
phrases.
right?
Yeah, just phrases. So we can say, I see. Anyone else? What can we say? I see.
Okay. All right.
Okay, all right.
Right.
Yeah, these things that native speakers, these words native speakers use to show that they're listening, right? So it's got to be like this. Mm-hmm. Oh, headache. All right. Now, actually, there's 2 types of fillers. Teodora, this is something new that I realized recently. You can do a normal filler. Mm-hmm, mm-hmm. But Teodora, what if it's like the patient is saying something really bad? Is there
Yeah, we can use I see from empathy, like.
What about the filler sounds, guys? Filler means just like a noise. If I say I'm in lots of pain, do you go? Mm-hmm.
Oh.
Yeah, it's not mm-hmm, it's
I see, maybe.
No, it's ah.
Oh.
Okay. So, guys, filler sounds normally, if you just want to show you're listening, uh-huh, mm-hmm. If it's something really bad, I lost my job yesterday. Don't say mm-hmm. You should be more like, like we change, okay? Now all of these we'll practice this week, but it's not difficult, let's be honest, it's not hard. It's just making noises to show that you're listening. But remember, OET are going to grade you from 0 to 3. So you can increase your score just by making these sounds. I think that's really good. Okay. All right, Shanice, could you say hello?
Hello.
What is D3? Could you read it to us?
Yeah, not using compound questions, leading questions.
So what is that?
don't ask two or more questions at the same time, just one only.
Give me an example.
Um, do you have what
Do you
did
have a
cause
headache?
this problem, or and how long do you have this problem?
Okay, so guys, two questions at the same time is very bad in OET. Is that clear, everyone? Just give me a yes or a no. You should
Yes.
never really ask two questions at the same time. So, Fumi, never say, "Do you have a headache?" and "Are you taking any medication?" Fumi, why is that wrong? Two questions.
Because confusing for the
Yeah, that's one reason. Anything else, though?
And maybe you cannot answer both. Maybe one of them patient will answer.
Exactly. They're not going to answer both. So if we're gathering information, right? If we're asking questions, gathering means to obtain information, obtaining. If we're trying to obtain information, we should not be asking two questions at the same time. You only get one answer sometimes, and you might forget. Okay. Right. So we have D1, D2, D3, D4. Can I ask for whose iPhone with their hands up? Who's that? Someone in the room that has iPhone with no camera, just iPhone. Is that Fareed? Anyway, how about Jana? Nice to see you, sir. Jana, welcome.
Hello, Alan. I'm good. Thank you for asking.
Would you mind reading that one?
Okay, summarizing information to encourage correction, invite further information. For example, we can ask the patient, as a result, how do you tell me how do you take your medicine? This kind of feedbacks to summarize the correction, to get correction.
Okay, that's a question. That's right. But I think here we need something. It's a good point, but did anyone who was speaking before just stay there, Jana?
Okay.
Come back, please. Nwimba.
Yes, I'm here.
Nwimba gave, I think, a slightly better example. You gave an example where you were trying to do this one, but you did this one. Do you remember what you said?
Yeah, now I know the difference.
Give me an example.
Okay, so for the 5, it's like maybe the patient explained to you they have several symptoms. They have a headache, abdominal pain, and maybe you don't even remember the third one. Maybe it was a fever or flu. And then you ask, like, if I understood you clearly, you said you have headache, fever, and abdominal pain. Is that right? Just to be sure if that's what the patient said.
And then at the end, is that right? Is that right?
Yeah. Or is that correct? Yeah.
So Jana, maybe there's your question, right? You can ask a question, but guys, this is just summarizing, right? It's just summarizing. But what does invite mean? Anyone invite?
To ask for a question.
Yeah. Do you have any? Well, not questions.
Do you want to add anything more?
Yeah. Do you want to
give them space to add anything?
Yeah, exactly. Now, we don't really need to say, guys, we don't actually need to say this, if I have understood you clearly, okay? There's nothing wrong with it, Nwimba, but you can just say a summary.
Okay.
So you can just, they're speaking, you just say, okay, so you have a very bad headache and you're not sleeping. Is that right? Yes. Do you want to add anything? No. Okay. So that would be D5, guys. Now, what we have been doing is creating a simple thing for the week. This is what I want you guys to study this week, to think about before tomorrow's class. Okay? So it should be summarizing and More? What did I miss here? Did I miss anything? I just realized I missed one. Camilla, what did I miss? No two.
Yes.
No
You missed
questions.
not lead questions?
No judgmental question.
No leading
Lead
questions. Well, it's not really judgmental, but let's
Not
have an example of a. Yeah, can we have an example maybe from Shanice? Do you know what a leading question is? What's a
You
leading-
have bad headache, don't you?
Yeah, so you have a bad headache, don't you? Or you might say, you wanted to be discharged now, don't you? Okay. This don't you. Does anyone know what this is called? Don't you? Aren't you? Haven't you?
No.
Leading question.
Tag question, tag.
These are called tag questions. And what you do is you take the auxiliary verb from the main sentence and you repeat it with the subject. So what's the auxiliary verb in this sentence? You want? Does anyone know what the auxiliary verb is?
Do.
It's do, right. But Maria, it's not here. Where is do?
Don't you?
It's in the negative. It's in the question. What's the negative of this? Everyone, negative. You do not want, right?
Yeah.
Okay. Or do you? Do you want? So that's the auxiliary verb in present simple. This is present simple. What if we say you have wanted to be discharged? What do we say here?
But you want it,
Haven't
but you don't want anymore.
You would change to haven't you? Okay. Or you will be discharged. What's the negative?
Won't you?
You. Okay. So these are called question tags. Don't worry, you don't need to study this because you should not use them. Okay. Or any question where you're pushing. This is what Theodora is saying. It's like a pushing question, isn't it? Pushing. No question should push a patient to say yes or no. That makes sense, everyone.
Yes.
It's almost like pressuring patients as well, pressuring. Okay. You want to be discharged now, don't you? Okay, goodbye. It's like you're pushing them to do it. Okay. So this is basically everything that OET say for information gathering. And I've tried to make it really, really simple. But one more time, do I actually need to do all of these things, guys?
No.
No. Let's think about what things we need to do, actually. It might be interesting to think about this. Theodora, do I always need to do listening techniques?
Yes, I think because this shows respect that we're listening to our patient.
What do we think, guys? Always listening techniques?
Yes.
Yeah.
I think so. So let's say always, okay?
Important. Yeah.
So always, I see. Oh, right. All of these noises, always. Asking questions.
Always, yes.
Always.
I think always, even if it's a really bad situation, always an open question, then a closed question. Okay, what about this one? D3.
This is also always.
What's the
Never.
negative?
Always.
What's the
Not to
negative?
do.
Never.
Not to do.
Never, right? So never do. Okay, it's like always, but the negative. Okay, this one, clarifying.
Always.
Sometimes.
If it's necessary.
Sometimes,
If
right?
it's necessary.
Your patient might not be unclear. If you try to do this when they are speaking very clearly, it's going to sound really bad. It's going to sound like you don't understand things. So only if the patient is talking a lot and maybe he's talking about unclear things. So sometimes. Summarizing. When?
Always.
Sometimes.
I think just sometimes, again, only when you think you can. Don't force it. Is that clear, guys? Don't force is like, don't push it too much with these. These are the ones you'll always do. Okay. Now, what's the most important one? What did I say?
Open and close question.
It's definitely this. I don't think there's
E2.
any doubt. There's no doubt on this because look,
It's 2.
if, especially say a doctor, but also nurses, pharmacists, dentists, if you can't ask questions and you know in the correct way, it's a really big problem for your job, I think. It's not just OET. A massive, massive part of your job is asking questions. All right. So what are the big problems with D2? This is what I want to talk about before we finish. What are the, can I show you a common mistake, everyone?
Yes.
So I need a patient. Can someone be my patient? Say hello.
will.
I can.
Okay, Julia. I'll choose Julia. So, guys, Julia is my patient. I want you to listen to this and tell me what's wrong and why. Okay. So, Julia, let's say you have a headache. Okay.
Yeah.
3, 2, 1, go. Hi there. My name's Alan. I'm one of the doctors in this clinic. Can I just confirm your name, please?
Hi, Alan. My name is Julia.
Okay, hi Julia, and I understand that you're having problems with your ongoing migraines. So how are you feeling at the moment?
I have headache. I don't know. My head is hurting a lot all the time.
Are you sleeping well?
Sometimes
Do you take painkillers?
I do, yes, all the time.
Okay, so it's a little bit subtle, but does anyone feel that something's slightly wrong with my
You
question?
just start with close question.
No empathy.
No empathy.
Number
you
one, there's no
decided
empathy. Okay, there's no empathy.
you decided that I have migraine.
No
And
open question.
one open question.
Well, no, I gave the context. I didn't decide it. Sometimes we say, I'm aware that, okay, and you can take the details from the cue card.
Or I can see from the notes.
Or I can see from your notes. But look, first thing was no empathy. Did anyone notice no empathy? Yeah?
Yes, you did.
So this is a common mistake. Just because you're asking questions does not mean you can forget about empathy. Okay? So here's the rule. Empathy before the next question. Okay, guys? Especially at the start. If you're asking them, how are you feeling today? Tell me about your symptoms. What are they going to tell you? Do you think they're going to just be really happy? No, they're going to be saying, oh, I feel bad. This is a problem. This is bad. So you need to be giving empathy before the questions. So like this, one more time, Julia. Julia?
So yeah, it's the same. What
One more
happened to
time,
me on the speaking? I went there. All in my mind was I will show empathy before I went to the exam. The problem is that you go to the exam and you forget. So all in my mind before the exam is I'll show empathy, whatever case it is. So I went in, she said, I have cut my hand. And I said, oh, I'm so sorry. It was that. And after that, all I was thinking was, what's my question? What I'm going to do? And I forgot.
Yeah, you can easily forget. Exactly. So guys, think of it as a sort of structure, empathy, question, empathy, question. So it's like this. Imagine one more time, Julia, you're my patient. Guys, I should be saying this. Oh, I'm sorry to hear that. Are you sleeping very well? And she
Yes,
said,
in some cases. Yeah.
okay. Well, I'm glad that you're sleeping, right? Empathy. Are you taking any pain medication?
Yes, all the time, unfortunately.
Okay, so it's just empathy, question, empathy, question, empathy, question. Does that make sense? This is a common mistake. Okay, another mistake. One more time. This time, Camilla, can you be my patient?
Yes.
Let's say that you have a headache again. Guys, listen to this. 3, 2, 1, go. Hi there. My name's Alan. I'm one of the nurses in this hospital. Can I confirm your name, please?
Yes, my name is Camila.
Okay, great. And may I call you, can I confirm your full name, please?
Maria Camila Reyes.
Okay, may I call you Camilla?
Yes, that's fine.
Okay, great. So Camilla, I'm aware you're having problems with headaches. Are you sleeping well?
No, not really. I'm not.
Are you taking any medication?
I am, but it's not working.
Okay. So this is maybe slightly more subtle, but why does that sound wrong? What was the mistake?
You didn't ask
Again,
how she's feeling, maybe.
I didn't ask him how I'm feeling.
How she's feeling.
no, again, no empathy.
There is no empathize.
There was no empathy as well. But there was one other problem now, another big problem.
There was no filler.
I didn't ask about
You
feelings.
started
Well,
close. You started.
Well,
Didn't listen her.
asking about feelings is an open question. I did 0 open questions. So going straight to closed questions is very bad. You're going to lose a lot of marks, I think, if you go immediately to closed questions. It just doesn't feel right. Okay, it should be like this. Camilla, one more time.
Okay.
How are you feeling today?
I'm not feeling good. I have headache.
Okay, could you tell me a bit more about your headache?
Yes, it started yesterday, and it had a fast onset, and it's causing me vomits.
Okay, and what do you think is causing it?
I think it's the pain, and I have no vertigo.
Okay, and are you taking any medication?
Yes, I had paracetamol.
Okay. How many open questions did I ask?
3.
It was 3. Feelings, tell me more, and what do you think? So it's much better. I hope you can hear that it sounds much better with open questions at the start. Okay, always open questions. But the big problem here is how many? How many? How many open questions?
Depends on the situation.
It depends, Shanice, right? So it just depends. Okay, so these are probably the 2 big errors I want to focus on. Can anyone think of any other errors? Are there any other mistakes people make? Murad, what other mistakes can people make? Murad, you put your hand up?
Yeah, by accident.
Can anyone think of any other mistakes we might make with asking questions or any of this, actually? Can anyone think of
Maybe repeating question.
this? Asking the same questions, not very good. Anything else, though?
It's like the same
Sometimes.
Not listening.
Now, Shanice, I'll take it, then I'll ask Farid. When you say not listening, what do you mean? Shanice.
And not listening means,
Go
the
on.
patients already mentioned something, but you asking the same question again and again.
So let's do this, Shanice. You're my patient. Guys, listen to this. How are you feeling today, Shanice?
I'm not feeling well.
Can you tell me a bit more about that?
I have a terrible headache.
Okay. And do you have a headache?
Yes, as I already mentioned, I have headache.
Right. So, guys, in the exam, you're going to be thinking about a lot of things, and it's very easy to just not listen to what they say. Okay. So not listening to answers and asking about things they already said. Is there any other mistakes we might make?
compound question.
Compound question is obviously bad. Do you have a headache, and are you sleeping well? Right, we shouldn't be using compound questions. Farid, is there anything else we might? Any other
Yes. Let's suppose. Okay, you have 2-week cough and headache and joint pain. So am I right? Do you want to eat something? And then we should go for the next bullet point. Sometimes we miss. I think we should summarize the thing.
Should summarize more. Well, definitely. Yes. People don't use that technique enough, Farid. I agree. Just the summarizing technique is very good. Julia, do you want to add one as well?
We get too concentrated on ourselves, how we do the questions, how many questions should we do, and we forget to stop and listen. We do a question, we go to another question, and we change the subjects without waiting for the patient to say what he wants to say.
You get a bit you get a bit overwhelmed or something. Okay, so I think these are the three main ones. I think what you're saying there, Julie, is basically similar to this. Now, tomorrow we're going to practice these things, but I want to focus on this one. Just quickly. Going immediately to closed questions, that's very bad, right? But how many open questions do we need? I already asked you, and Shanice said it depends. What does it depend on?
Because if the patient is going to
Theodora, go
speak
on.
a lot, yes, we don't have this chance to ask too many open questions. Okay, we can do one, but if he's very speaking a lot, we cannot do too many because.
What's the opposite of speaking a lot? What's the opposite, guys?
Speaking.
Not speaking at all.
Speaking is not speaking, shy maybe, or something like this, not speaking. So you can think of it like a range. You know what I mean? So if the patient is speaking a lot, you might only need one question, one open question. For example, Theodora asked me, how are you feeling today?
How are you feeling today, Alan?
Well, I have a headache. It's on the right-hand side. It's radiating down my neck. I'm taking paracetamol, but I'm not taking ibuprofen. I'm not sleeping very well, only about 4 hours every night.
I see. What do you think is causing all this, Alan?
Okay, so how many open questions am I going to need in this situation?
Maybe one.
One or two, right? For a person like this, you're going to ask one or two open questions. So Theodora, she wanted another one. She wanted to ask me one more. That's okay. But now, ask me again.
How are you feeling, Alan?
Not very good.
I see. Could you tell me more about that?
Yeah, I've got this headache.
I see. And what do you think is causing your headache?
I'm not sure.
Have you taken any medication?
Yes. Okay. So she's gone to closed questions there. Have you taken? That's closed. But Theodora, is it the right time to go to closed questions?
Maybe not.
I think here we need 2 to 4, because the person's not speaking. Now, look, it's very extreme. Don't worry, in your exam, the patient's not going to be like, Theodora, I'm sorry, it's too difficult. Normally they're like here, aren't they? Or they're here. They're not going to be very, very extreme, but you need to be ready to deal with this. Does that make sense, guys? You need to be able to deal with this. You need to be able to deal with this. Many students have told me after the exam that, honestly, thank you, Alan, for teaching this, because my patient was just not speaking at the start, but you taught me what to do. Okay, so I think this is a really good thing to focus on, and we're going to focus on it tomorrow. Does that make sense? Tomorrow in groups, open and closed questions. But does it make sense what I'm saying for now, guys? Is this clear what I'm saying, everyone?
Yes.
Yes.
It's just about it's nothing, it's not very difficult, is it? You just need to use your feeling, like how many open questions here? But also you need at least 4 good ones. I'll teach you them tomorrow, at least 4 good open questions, and I'll give you lots of examples of closed questions. But for now, I think we'll just leave it. We'll stop here. Uko, do you want to ask me a quick question?
Yes. It's about the patient. When the patient says, I'm not sure. What if you ask the patient, please, may I know what you're not sure about?
Yeah, no, it's these kind of things, guys. It's the ability to just keep pushing, keep opening then. Does that make sense? You need to leave space at the start of the dialogue for them to speak. you shouldn't be controlling what happens. It should be very open, like, why? Tell me more. What do you think? These kinds of questions. And if they're very, very shy and they don't want to speak, maybe 3 or 4 of those. Okay. Anissa, quick question before we finish.
Yeah, quick question. Sorry for that. So, as we know, there are 2 situations in speaking part. Can one be gathering information and the other situation giving information, or made possible to be, for example, both of them gathering information?
It's usually 2 in the card. When you say 2 situations, what do you mean? Giving or gathering? Is that what you mean?
Yeah, no, that's what I mean.
There's usually a mix of, there's at least 1 chance for both in every card. Okay. But how much you need to do changes. So it might be that in 1 card, there's lots of information giving, and in another card, there's lots of information gathering. They're not all exactly the same level. But guys, there's definitely both.
Okay.
Right? So you need to, when you do your test, you should be going in thinking, I need to show OET that I can gather information. I can ask questions. I also need to show OET that I can explain things from last week. Okay, so can everyone see in the chat that there's a copy of this? Does everyone see that in the chat? This diagram?
Yes. Yes.
Yeah. So if you're new to OET, please can I ask you to review that before tomorrow? Just look at the questions, look at what I'm talking about, and come back tomorrow ready to practice this. Okay. So I'm going to finish there. Thank you very much, guys. Hope this was useful.
Thank you.
Thank you, Alan.
Goodbye.
Thank you very much.
I'll see you all later. See you in the later class. Thanks, guys.
See you, everybody.
Thanks, everyone.